similar to this morning, we'd like to start exploring resilient health systems with our panel. But this is a panel who are really engaged with implementation and innovations. And so whilst this morning's panel was very high level, we're going to ask our colleagues on this panel to give us some actual real life examples of ways that they are innovating and engaging with innovations to build resilience. So starting off, I'm going to ask the whole panel what their understanding of a resilient health system is, and what a resilient health system looks like to them, or what resilience in health means. And maybe as we put Paul and Backer on the spot to start with, maybe we'll start the other end with Sabrina, Dr. Sabrina, if you would like to start us off. If you wanted to add anything else to your introduction to illustrate your point, please add something about yourself before you start.
Thank you very much, and I'd like to say thank you to the organizers for inviting us as the Research and Innovation Fund of Makerere University. I sit here as the vice chairperson of that grant. And when I talk about resilience, I think it's important for us to appreciate that we've just gone through a terrible pandemic, the COVID-19 pandemic, and it came very clear to us that if we were not innovative enough, we would probably all succumb to death. And so resilience included being innovative around survival, mere survival. And I'd like to say that the Research and Innovation Fund, whereas it was aimed at doing research and innovation in all aspects of life, during the COVID-19 pandemic created a grant that was looking specifically at COVID-19 innovations. And for me, this is an example of resilience. People waking up and saying we are able to develop our own antibody tests. We are also able to develop our own vaccines. We are yet to see a vaccine being developed here, but that's what we talk about when we say resilience. That you're self-sustaining and that you can survive even without support from outside.
Thank you so much, Sabrina, for starting us off on such a strong footage. Dr. Paul Bitter-Heibeo, I'm sorry, I'm not sure why I'm struggling to pronounce your surname today, but Dr. Paul, do you want to take us away?
Yeah, no worries. Just a correction. I'm not a doctor, just in case.
I think everybody on the panel can be an honorary doctor this afternoon. How about that?
Come to me for medical services. Yeah, so on top of what previous speakers spoke about, I think the other thing that we need to also look at in terms of resilience of a health system is one that can minimize shocks, but also one where you would be able to learn the consequences. They would be able to highlight those consequences, or at least be easily seen, and one that is adaptable and adoptable. Because things change, parameters change, dynamics change, focus changes, whether naturally or unnaturally, and therefore systems should be able to move with the changing focus of the day.
Thank you, Paul. We'll go to Kevin for now.
Just to add on what Sabrina and Paul mentioned, in terms of resilience, being able to withstand the hardships when they come, but most importantly also continuing to have the continuity of business for other, things that might be affected by that shock. So to me, that's the test of resilience, that you don't gear all your energy on what you're being faced with at that moment, however devastating it is, because there are other concerns, there are other problems that you continue to address that you must mitigate, otherwise they also end up being catastrophic. that becomes very important when you're thinking of resilience. And it becomes very important that in so many dimensions, you have to make sure that lots of things are in place, for that to happen. You've got to have the workforce, that's not just number of healthcare or service providers that are out there, but, with the right capacity, with the right skill set, to be able to handle the business they do, in unusual situations. The financing bit which was mentioned by WASFA, that, they are trying to innovate and whatever, but if there is the resources to do that are not in place, it gets complicated, but also, most importantly, having the leadership and governance, that embraces, that is adaptive. So, for instance, remember when the pandemic came, the COVID-19 came, people started questioning, because of the innovations that happened so fast, everyone was questioning, we've been having vaccines, being tried for 10 years or whatever, but you're telling us in months, a couple of months you have this. So it took leadership and governance to actually, demonstrate and have it, delivered to people that, given the changing times, and innovations and what we've learned before and leveraging it, this is possible, it is safe, we can do it. So I could go on and go on, having the medicines in place, because, if you're faced with a medical whatever and then the logistical part of it is not working, then your system is not resilient. Because at that time, what people need are the medicines, they need to have them. You need the technology, which we are talking about here, because if you're going to do things the same way when everyone is locked in their house, like what happened to us during COVID, then your system is going to be tested. It's not resilient. It's not resilient at that time. So you need to innovate. You need the technology. You need the information systems, and so many things. But I think I should leave some for
So I think what we're hearing is the resilience across the health system, and the health systems are complex, and every building block requires that resilience. I think maybe we'll go to Ernest now. So Ernest has wide experience across the continent. So maybe, Ernest, from your experience continent-wide, you can, give us a picture on what you see as a very resilient health system.
So one quick comment first on resilience, and I like to make the point that resilience to me is an ability. It's not just simply an assembly of the right elements together in one place. It's actually an ability, and I think as most of the speakers have touched on, if you lack this ability, then you're always caught flat-footed. And so even if you have all the elements in place, if you've not, for example, practiced actualizing that collaboration, let's say between public and private sector, to respond to a big new threat, or actualize how you move quickly from new policy formulation into implementation. And if you've not done that, when you're faced with a sudden threat, you're actually not resilient, right? No matter what you say. And so for me, I like to give the example of, if you told me right at this minute, Ernest, do a backflip, I would probably kill myself, right? And yet some of these threats come along, and it requires us.
We're a little bit frozen. We'll just wait a second, see if Ernest comes back.
I'll go off video and keep it back to it.
Yes, I think that.
Okay. I was saying, so to me, resilience really is a practiced state of being where we're constantly in the model where we're making sure we're ready. And COVID to me is a great sort of, I'd say, dry run for us as a continent and as countries for what practice state of being we need to have to be prepared for the next thing, but more importantly, to address the things that have been bedeviling us all along, which we've not succeeded in addressing effectively. And the lessons, I think, from COVID can be applied to our current epidemics of HIV, of diabetes, of obesity, of mental health, these things that we have currently that we're not, quote unquote, applying the resilience we're talking about to. So in a way, I think that if we view COVID almost as it forced us to understand the priority nature of getting this right, the existential reason why we need to do this. And I think if we frame it in those terms, then we now understand, without, for example, there being a crisis, why we need to, for example, practice collaborating more effectively, in particular when talking about cross-sectoral collaboration.
Thank you, Ernest. Oops. Is that echo's gone? Thank you. So we're hearing about learning and about practice. So Dr. Moha, you obviously were very active during the COVID pandemic, and you're also still going through the Ebola. So I think you sleep and breathe resilience. Would you like to add anything to what our colleagues have said? I know we've covered a lot of the areas.
So thank you, Rosalind. I think what strikes me is that sometimes, we use the word shock, and we really don't characterize it. Uganda is different. I think while we may think broadly, we also have to think about our local context. And we have some of the deadliest infections in the world that show up from time to time. They live here. So, even if you hear the name Sudan, it's from here, right? Bujo is from here. Marburg, we have it here. Zaire comes across the border from time to time, but we probably have it here as well. And that's just, the filoviruses. What is unique about those types of diseases is that they have an impact on your attempts to be resilient, because they target the healthcare worker. Okay. Because they tend to target the healthcare worker. These are diseases that amplify in our hospitals. And by doing that, they send fear throughout the health system and actually reduce your ability to be resilient to any other shock. And I think being very clear about what is the threat we face. The threat we face is that a health worker manages a patient with a fever, and then is told, oh, you're a contact for somebody with Marburg. That's unusual. If that person gets the disease, there's a 50-50 chance the person survives. That's unusual. And when we think about the broader, being resilient to broader shocks, we also have to pick out those that terrorize our system and put additional investment so that when they happen, we detect them early, we can keep them small, can provide treatment to those people that have it, vaccinate their contacts, and bring them to an end quickly.
Thank you. So thank you. Thinking about really the current situation we're in. So as per protocol, our most senior member of the panel is speaking last on this topic. So Paul and Mbaka, we hand over to you. And really what we would like to hear, and I'm sure you're going to do this, but as the Ministry of Health, as our leadership in this area, the MOH priorities for making our health system resilient.
Thank you very much. Of course, the organizers connived to make the government look clueless. Everyone has said everything, but I'll attempt to add a few. Of course, just to summarize, when we talk about a resilient health system, from time to time we will have to deal with some form of storm to the health sector. There are things that we need to be sure that we can do. One of them is that we can weather a storm, we can minimize its effect, we can recover once the storm is gone, but because of the fact that we were in this storm, we can prepare for the next. You carried a sweater, which is a windbreaker, and then after the storm, you realize that actually it was a bit wet, and the sweater was the wrong tool to carry, so you prepare better. This is typically what we go through, and in Uganda, they say that there's a silver lining in everything. But like Dr. Moha has said, we are constantly suffering a storm of all sorts of just upsurges of common conditions like malaria, just overwhelming a facility that usually sees about 4 or 5 patients to start seeing 1,000 in no time, or something that happens rarely and occasionally with significant impact like the Ebola outbreak that we're currently receiving. Important to make a health system resilient, of course, is awareness. People have to know. You know, they say that there's a thin line between, not a thin line, but there's a real difference between being brave and being stupid. If you go around clowning near a python, that is not evidence of bravery, it is evidence of stupidity. But what you need to do, and like Dr. Moha mentioned, is that we are going to face these challenges all the time, and we need to be prepared enough to be able to face them. We need to recognize the dangers that we're dealing with, but also know, with the availability, in the presence of this danger, how can we deal with the problem in such a way that you prevent it from blowing beyond where you can manage it, but also ensure that you take care of yourself. For those of you who have been in a plane, many times they tell you, you know, fix your oxygen mask before you try to fix that one of the child. If you are a health worker and you're providing response and you are not sure what you're dealing with, you do not know how to deal with it, you'll probably die, and then there's, you know, you cannot generate a health worker within a few days. So there's a lot of work that needs to go into preparing people for these shocks. A lot of it is training, but some of it is equipment. You know, sometimes there's a story told about Uganda that when the Tanzanians came to overthrow Amin, they found Amin had just bought state-of-the-art artillery equipment, but he did not have experts to use it. The Tanzanians who did not have the equipment knew how to use it. When they came, they just turned the orientation of the gun from pointing south to pointing north. So there are quite a number of equipment that we have, whether they are test kits, whether they are tools that we use to support things like contact tracing, investigations, and so on, that we need to know how to use. We need to know how to use them as we prepare for some of these things. Because, like has already been mentioned by colleagues, early identification is really the key to dealing with most of the shocks that we deal with, whether it is financial, whether it is just a natural outbreak and so on. If you respond quickly, you usually mitigate the effects quite fast. Thank you.
Thank you. So thanks, Paul, for bringing all the strands together. So just sticking with you now, I think a lot of our innovators are young people who are starting off in their innovation journey, don't know what kind of frameworks and things we have in place to, you know, to guide the translation of their ideas into the health system. So maybe you could just give an introduction to the sorts of frameworks that the ministry has, the sorts of things that Dr. Waswa was talking about in terms of navigating the space as an innovator to try and get your innovation into the health system. Thanks.
Yeah, thank you very much. I think this is a very good question for many reasons. We at the Ministry of Health, we're always sitting and we're invited for dissemination meetings, whether it is for research or innovation. And we are always wondering, who are these guys innovating for? But you also have innovators on the other side, and they're saying, you know, we are coming up with all these cool things, but we just don't know why those guys will not pay attention to them. I know I might sound a bit like a broken record, but I failed to find another analogy that is as effective as this one. Imagine you are thirsty, and you are also sitting and I offer you a glass of water, I'm wondering whether you're going to pay attention to my glass of water when you are sitting on a pin. So the issue here is, what is my most pressing challenge? You do not know it. What we need is a mechanism to facilitate my communication. The problem with most innovators is that they pick a problem in the sector, and these are problems that we have. They sit in a dark room, figure it out. But when they come, it is just one of the problems that I have, and not the one that I have prioritized, or the one that is causing me sleepless nights. If we do not come up with a mechanism to allow you people to interface with us, we shall have a problem. And it is not that we don't have these mechanisms, but we have inefficient ones. So today, what happens if you innovate? Today, what happens if you innovate? You write to the Director General of Health Services, tell him I have this innovation, and then he will channel it accordingly. That would be good in an environment where innovations do not come up very frequently. What was that? There was something about velocity and so on. The innovations are coming up very quickly about very many things. This framework we have been using has proved ineffective because of the scale and speed with which we are currently innovating. We need a platform that is brokered by really a few people that can aggregate these innovations and present them in one bundle. And the best time to, and where we fail is that at the time of putting these ideas together, that is the best time to engage. If you engage when you have the answers, perhaps you would have solved my problem, but perhaps you may not have. So we should engage at the time when we bring up these ideas, but there is an opportunity, and Dr. Suraj mentioned this already, that if we can make this innovation hub, that cluster that he proposed, that actually some work had gone into already, if we can bring it to life, it will present a very good opportunity to allow us interface. We can bring to you our problems. By the time an innovation comes up, it is answering something that we're already ready to receive. Because we have so many problems that we need fixed. But where do you channel them? We have no one to listen to us. And when the innovators bring their things, we say, okay, this is good, first put it here, but you know, this is actually what I wanted. So we have that kind of communication challenge that the innovation cluster can actually resolve. Thank you very much.
Thank you. So that's a really great kind of example of innovators, how discussing with the people who are the end users, so the Ministry of Health, is so vitally important for us. So just going slightly downstream a little bit, or is it upstream? Perhaps upstream. Maybe we can hear from Dr. Sabrina about, from a research perspective and from an academic perspective, how the university is using the research fund to also align with the kind of strategic priorities of the country in healthcare resilience.
Thank you so much. So, Makerere University received over 79 billion Ugandan shillings to develop research and innovations that are meant for Ugandans, really. And the core was aimed at answering questions and gaps that are related to the National Development Goal number 3, as well as the Sustainable Development Goal. And the objective of the fund is to increase the local generation of translatable research and also scalable innovations. And this year, the fund is giving 2.9 billion Ugandan shillings to innovations that have reached beyond proof of concept. Some of these are health innovations. And these are innovations that are at a stage of transition that will help problems of Uganda, and also it's the very first kind of its own grant mechanism that looks at research and innovation in a local context. it just shows me, for me, that government is working very closely with academia to answer questions that are translatable for the country. And it's an important thing. I know that many universities have questioned why Makerere, but Makerere is the oldest university in the country. Actually, in East Africa, it's 100 years of age. And other universities are also going to be funded under the same funding mechanism so that this spreads out. But even though the fund is initially for Makerere, the research and innovations are done throughout the country. Since 2019, Makerere Research and Innovation Fund has funded over 775 different research projects, which are scattered all over the country. So I think for me, this is a good way to start, a way that looks at by Uganda, for Ugandans, and problems that are being solved by young researchers partnering with colleagues from Makerere University to solve our own problems.
Thank you. That's great, and to hear about the fund and the funding. And just to clarify, that's the government of Uganda funding to Makerere.
That's the government of Uganda funds to Makerere, and we are in our 4th year of grant support to the researchers. But for the young researchers out here, I want you to understand that you are also allowed to partner with somebody working at Makerere University and be able to scale up your commercialization project.
Thank you so much.
In our country, and we're looking at problems today, we have people who our government has invested in for over 13 years. That is primary 7, senior 6, so that's 13 years, right? What mechanisms do we have in our country to try and ensure that after 13 years, we're investing in these people, they can help with our problems?
I don't have a straight up out of the jacket answer, but there are a couple of ways this would happen, because one, it starts with the interest. I mean, even if people are out there and they're not interested in the kind of discussions we are trying to discuss now, they don't want to be part of the innovation, they don't want to be part of the processes, they don't want to be part of the bigger ideas that you're trying to, advocate them for, then certainly to yield nothing. So it takes individual initiative. There could be mechanisms, there could be platforms created by the government, and many of them exist, like Dr. Sabrina has mentioned, that the funds available at Makerere for people to benefit are there, but people don't even have awareness, and it's not that Makerere maybe hasn't broadcast. So it's about networking, creating platforms for beyond interest, but people need to network, people need to create alliances, while you're still in school, and places like this create an opportunity. You don't just sit and listen to us and you go out, but everyone who is in here probably has come to share something or to say something. So use these opportunities to network so that you get your mind stimulated, because that's where innovation starts from. It is the ideas, the big ideas you'll never know that will even ever come to a big thing. So to me, that would be my contribution, that it takes personal initiative, that even if they've invested in you and you're still in this age bracket, if you don't have the interest, you'll still be probably in another place altogether. So go through awareness, discovery, know what you like, and identify the people you think will get you there, and network so that you join those communities. And most of these big initiatives now creating what we call communities of practice, where they are voluntary. They just look for people to join. It just takes awareness and interest, and you'll go there and they will probably mentor you and grow you into the kind of person you want. So for me, I would say that to everyone who is here, it starts with you, and then using the opportunities around you, the person seated next to you, the people have been presenting like Waswa, look out for them, exchange contacts, ask them, I want to be like you, use artificial intelligence, sort of bigger things, and I'm sure I will point you to something. When he started out, I wasn't sure I would meet the Carl Lightons at Digital Square, but he's now there, so that's how it starts. Thank you.
Just to say that, we often see it from the other point of view, where maybe the government needs to do something for the younger people. But with COVID-19, even with Ebola, many times the government needs young people to do something, for example, for health responses. Young people, for example, have a very strong ability to use new technologies and social media. There are young people that have up to 1 million followers, and that is a bigger platform or bigger stage than we can get in many of our media houses if we're trying to communicate about health. And I think that the same way young people brand for companies, you know, alcohol, tobacco, you can also brand for health and seek those partnerships. Sometimes it's not even you that is but you have the information that no, you can reach more people if you did it by contacting this person or that person. So I think we need to start looking at the resource that is present in our youth that can help us be more resilient when these threats arise.
Thank you. So young people, don't underestimate your power and look for a mentor. Sabrina?
I think that learning starts right from the age of nursery school, and the government has clearly supported early childhood learning centers, which are more inquisitive, looking at colors. Don't underestimate that. I think it's important. And then we know that the secondary school curriculum has also been adapted to be more innovative around involvement of the learner. I'm sorry to reflect back to Makerere University, but Makerere University's School of Medicine has for a long time been student-centered, that the learner becomes more inquisitive and more interested in what they are learning. And I think that young people need to take advantage of this. When the president always talks about science, technology, engineering, all those things, that is what drives innovation. I mean, it's okay to learn history and literature, but it's not going to make your mind inquisitive. So as learners learn, they need to learn to unlearn, even the artists, to understand that even music is a science, or that fine art is a science, and appreciate it in that aspect.
I'm perturbed. When you mentioned that innovators are there, but it's like there is no mechanism for government to know about them. While the first speaker, Madam Doctor, says the innovative, call them as you had, fund given to Makerere University has been used all over the country. That is where the problem is. To me, actually, that is already government. That is also government. Now, where is the missing link? That government cannot know about the innovators. Who is supposed to do it? That is a bit ambiguous to me. Help me understand that. Thank you very much.
Thank you. So I think that relates to the last question. It's similar to the last question that I was going to ask. And as we're out of time, I'm going to add this question onto the submission from our colleague. So it's an interesting question. Whose responsibility is it to ensure that innovations are adapted within health systems? I don't know if we've got Dr. Darko still online. Dr. Darko, can you hear us? Because I could go to you first. Okay, maybe not. So maybe Paul. Oh, Dr. Darko. So you've had lots of experience of this. So could you give us an answer on this one? Whose responsibility do you think it is to ensure that innovations are adopted into health systems. And this is going to be a quick fire round, so one sentence from all of our speakers, please, if that's okay.
It is the role of leadership to ensure that innovations are adopted and accepted. In particular, the enemy of innovation is familiarity. And to move people from what's familiar to doing something new requires leadership to really be extremely deliberate about saying we are changing from state A to state B. This might include legislating, for example, certain things. I'll give you an example with, for example, the introduction of electronic medical records in the United States. I was doing my medical school at the time that this was happening, and they had tried before to ask people, put things in the electronic record, capture it from paper, and it wasn't working. So finally, they just actually legislated that there'll be no paper in those health facilities. They eliminated it completely, and people were forced to then actually go to electronic. So I think for certain things, for us to really change from where we are now to a new state of being, we really do need leadership to drive the way. And then very, very importantly, private sector is really the key engine for being entrepreneurial and going out and sorting out complex things. It is really not the role of government, and it's not necessarily really the role of academia to do that. It is your private sector, the young people we're talking about, who actually need to be empowered to go and do these things. And we need to do a lot better with creating a deliberate framework for engaging and bringing in innovation from A to Z. From helping people set up, helping them scale up, and we should be shameless about supporting our local entrepreneurs in this manner.
Thank you. Paul and Bacco?
Yeah, so when we say that we have an efficient mechanism, we're basically talking about scale. It does not mean innovators do not reach the Ministry of Health. It is just what fraction of the possible innovators out there can access the Ministry of Health and present to them their innovation. And that's why I was telling you that we have a mechanism, you write to the DG and so on, but it has significantly limited the scale to which innovations can reach us. And that's why we need to broaden that process to allow more people to really present their innovations for consideration. Thank you.
Thank you. Dr. Mohammed?
One of the challenges is that not all innovations get taken up. And I think that there is that responsibility for academia, research organizations to help the innovators document what they've done, evaluate whether those things can be improved in future, and if nothing else, serve as a time capsule where they keep that knowledge for the future, because something that might not be important at that moment might become very relevant down the road. So research organizations and academia facilitate this process by ensuring that ideas are not lost altogether.
Thank you. I like the time capsule. Kenneth?
What all the others have said are right, but I think also, for me, I would say the innovators themselves, alongside, the entire society, the onus is in the hands of everyone, because if usually the way ideas are incubated, whether at individual level, in group level, it starts with abstract things somewhere in your room, or a school project. You saw WhatsApp started, or Facebook, it was a school project, also I think it was Facebook, a school project. But now, if these guys didn't broadcast, if they didn't look out for a target audience, to showcase what they have done, then it would die on arrival. So it takes the innovator themselves also to look out for what would have been like their potential customer or something, to try to showcase so that, it gets known, and then the society also to embrace it afterward. Ernest mentioned that, there's an enabling environment for people, either legislation that permits such things to be brought up, or, guidelines within for instance, for ministry, the target ministries, Ministry of Health, also create a platform that maybe next time, instead of this being just a thing of the academy from Makerere, but if they partner with Ministry of Health, and then we have so many Ministry of Health people here from different divisions and different departments, trying to listen in and asking some of these people to go and, to try to showcase what they are trying out there, you'll be amazed. So to me, it is both the innovator, the society, with the best of all the other things mentioned. Thank you.
Thank you, and we would absolutely love and welcome that, and maybe through the WHO platform that will also happen. Paul?
Sorry. Yeah, I was going to say that, just to add on to what Kenneth says, that yeah, it is the innovator plus all the gatekeepers and decision makers in whichever institution or organization it will be. But the one thing that to caution is that, you know, it has to speak, that innovation has to speak to the need at the time in order for it to be, you know, in order to get a buy-in, in order for them to see the relevance of it, you know, in order for them to see, you know, the impact of it, you know, because, you know, like in many organizations or institutions, you know, people get disheartened because there's so many innovations that come up. But if they're not speaking to what we want or what we need at the moment, you know, people go away disgruntled and, you know, and dejected. But very, very critical. You create an innovation, the need of the season, of the time, has to be key for it to go through. Thanks.
Thank you so much. And Sabrina?
Just to add on to what everyone has said, I think there is a need for clear communication lines, and the communication should be integrated. We need to take advantage of the media houses and the social media houses, that if an innovation is functional and important, it needs to get to everyone. And that is how, if you do not speak about it, it will not be bought, it won't be funded. So you have to make your innovation important enough to be talked about all the time. But even the people who fund these innovations have to have a clear way in which they disseminate information. I'll give an example of the Research and Innovation Fund. If a research project is ended, the research fund has a component of dissemination, and that's a critical thing. And dissemination doesn't stop at sitting in a room and disseminating, but also writing a policy brief to the parliamentarians, writing a policy brief to those who matter, and also writing a manuscript that is shared with everyone. Because remember, if you're not integrating your dissemination of information, if you need funding from the, you know, endorsement from Parliament, and you just share it amongst yourselves in your little room, then it will not be funded. So there's a need for improving the communication framework, but also engaging all the stakeholders so that the innovation is shared widely. Thank you.
Thank you so much. To try and summarize, we've heard about, you know, how innovations can help with resilience, how we can use our learnings from previous crises or shocks to take ourselves forward, where the role of ministry, but also the role of research comes into enabling an innovation environment. And, you know, we have heard from our young people and from some of our innovators that this journey is not easy, and it really isn't easy. You know, we all have many stories, and whilst we're over your average age up here, and some of our speakers, I really would encourage you to use this opportunity to reach out and try and find a mentor over the next couple of days. Try and find somebody. Everyone here in the older age group is interested and curious in innovations, and we love meeting new people, and we love meeting young people who have ideas. So reach out to us, try and find yourselves a mentor, because it's an exciting journey, but not an easy one, and do look to us, you know, to see how we can support.